Today, we're going to be talking about retinal lasers. In the field of ophthalmology, we use lasers for a variety of treatment conditions. In our particular field, or vitreoretinal surgery, we most often use lasers for the treatment of retinal tears, retinal detachments, and bleeding in the eye. Whenever we use the word laser, many folks think that we're performing LASIK surgery. That's a procedure where the cornea is reshaped to help people see better. That's not what we do in our office. The laser that we're doing provides welding or treatment of leaking blood vessels in the back of the eye and does not remove the need for your glasses. For example, if you have a retinal tear or a retinal detachment, you might come to our office. After diagnosing and detecting the issue, you would be placed in a room in our office that has a similar chair to where we examine you. We would put your chin gently on this machine and shine some bright lights in your eyes. These bright lights, many times yellow and green, can sting a little bit and feel like a brain freeze. But this symptom is very short-lived. Usually the laser takes anywhere between 2 to 3 minutes, and after the laser is complete, for a minute or two, your vision might be blurred. But at the end of that, you return before you leave our office to your regular dilated state, and within a few hours, when the dilation wears off, your vision is typically back to what it was before you walked into our office. Many times, people ask if there's any restrictions after the laser. It really depends upon the reason you're having the laser. If you're having the laser for a retinal tear or detachment, your physician may advise that you're not very active for a certain period of time, but your physician will guide you as to what that duration should be. In terms of having laser to weld certain leaking blood vessels in the back, there may not be any physical restrictions. Generally speaking, by the time the dilation is worn off, most people can return to the normal activity. There's no restrictions on water, such as bathing or showering, because the laser does not create an incision into your eye, and therefore you can resume most normal activities, but I would ask your physician, depending on your specific condition, what those restrictions are. Depending on the nature of why you received retinal laser, a follow-up would be scheduled. If it's a retinal tear detachment, it might be sooner. If it's from leaking blood vessels, it might be later. But before you leave the office that day, our checkout team will make the appropriate follow-up interval based on what your physician has recommended. So after you go home, if you experience significant pain or reduced vision or something unexpected, know that our phone lines are always open. You can call us 24/7. During the daytime, a member of our call center team may take your phone call, but after hours, our physicians are always available to answer any of your urgent questions. We look forward to taking care of you at Georgia Retina.